assessment of the threat posed by the virus. It doesn't change what WHO is doing, and it doesn't change what countries should do.
All right, so that's Dr. Tedros Gabriel Jesus. He is the Director General of the World Health Organization, saying now, unfortunately, this has become a global pandemic. And here are some numbers that he spoke to, and we're going to project it on your screens shortly. The coronavirus death so far has exceeded 4,000, so that's 4,006 as of this evening. 125,811 confirmed cases in 122 countries and territories. And in Africa, 8 countries have recorded confirmed coronavirus cases. In China, where the virus started from, a total of 80,754 cases have been confirmed, out of which the majority of those who have died came from China. That's in excess of over 3,000 people. So all the deaths, if you subtract that from the 4,000 globally, majority, almost 89% of the deaths came from or happened in China, unfortunately. France said that there had been 48 deaths in the country with over 2,000 confirmed cases reported. Germany has 1,567 confirmed cases. Italy has declared a total shutdown. So schools are no more in session, no public gatherings. And today, if you watch international media, very empty streets and shops. And then also they are saying that they are even sporting activities have been placed on ban. Thousands of flights cancelled worldwide as airlines also struggle to cope with the slump in demand. People are simply not traveling. And if you look at this map, it gives you a fair idea of where the virus is currently and how it is spreading. The darker the color, the more intense the virus is. So if you look on your screens now, China is the darkest because that was the epicenter. That's where most confirmed cases have been recorded, and that's where you also have the most deaths. Then after China, we have Italy, Iran, Japan, South Korea, all recording very increased numbers of persons dying there. You have countries like the US, the UK, all recording, and in Africa, 8 countries I mentioned earlier have all recorded coronavirus cases, and it is spreading at an unfortunately alarming rate. Here are the key things that we all need to know. Immediately you start having signs and symptoms of cough, headache, difficulty in breathing, quickly go to the nearest hospital and then get checked. It may be just a regular flu. It may be a regular flu. It may not necessarily be the coronavirus, but you can't be too sure. You just need to be very careful. Go there for treatment if you have any of these symptoms. And then these are the signs we've been warning you all about. It has to do with the fact that you have to consistently wash your hands with soap under running water. With soap under running water. Use tissue or handkerchiefs when you sneeze or cough. Cover your nostrils, all your orifices when you're coughing. And then also, don't touch your face, because in case you have picked the virus, you could easily infect yourself by putting it in any of the openings on your face, your eyes, your nostrils, your mouth. So these are the three key things. And the president in his speech reiterated that. And finally, do not shake hands. Do not shake hands until further notice. So these are the key things that we've been talking about, and we are hoping that in the coming days we'll hear something more concrete about Ghana's preparedness. Like the president has said, $100 million, its equivalent in cedis, has been put aside to make sure that we are very adequately prepared and hopefully would not record any such case. So let me introduce my colleagues who are with me here. Zubaida Ismail, on my far left, is our Northern Regional Correspondent, Senior Broadcast Journalist here at Media General. Hello, Zubaida.
Hi, Martin.
And then also we have Rosina Foster. The name Foster is on my mind. So Rosina Foster is editor at Onia FM, and also she's with Media General, senior broadcast journalist as well. And I'm Martin Esiedudati. So ladies, good evening and thank you for joining me on the show. I think this week was International Women's, well, this month is International Women's Month.
Yes.
So maybe International Women's Happy International Women's Month to you. I think that's an order. Okay.
Thank you.
And I'll start with you, Zubeida. We listened to the president. He touched on a number